and motivation of the paper. I will present you the data that we use for our analysis, then the methodology, the main result, and at the end, some summary conclusion. So as you might all be aware, loneliness is a very debated topic in the public debate, and has been recently identified, particularly in the media, as an epidemic or described as a crisis. And in the academic literature, it's actually been identified as the next public health crisis after smoking and obesity. This is because it is becoming increasingly common over the past few years. The amount of people that actually report to experience loneliness at least once. And this might have actually risen with the advent of the COVID-19 pandemic. So loneliness has been defined in different ways. Different definitions emphasize the social aspect, the emotional component. Here in this paper, we use this definition provided by Cacioppo and Patrick in 2008, where they actually define loneliness as the gap between what the individuals want or expect from social relationship and what they actually experience. So loneliness, that you could imagine, is of course related and associated with a series of adverse health outcomes, such as mental health problems, depression, anxiety, sleep disorder, but also physical problems, particularly health condition, dementia, altered endocrine immune functioning. But also by reducing the ability to self-regulate, lonely people tend also to report a reduction in cognitive functioning. Loneliness also increases unhealthy behavior such as alcohol and drug abuse, but also increase the odds of early mortality. And in fact, loneliness is one of the main factors associated with the deaths of despair described by Case and Angus Deaton. But loneliness is not only relevant from a public health perspective, but is actually associated, it comes with socioeconomic cost. In particular, lonely individuals tend to emphasize a lot negative information, tend to have more negative expectation, social expectation, and are more pessimistic and hostile towards other people. This loop of negativity, anxiety, depression, that tends to further contribute and aggravate their sense of isolation and detachment, and reduce their political participation, for example. So lonely people tend to engage less in voting behavior, but also lead towards economic outcome in terms of lower productivity. So just to provide you an overview before we go into the detail of the paper. So the idea is to study the dynamic pattern of loneliness and the predictive or protective factor during the COVID-19 pandemic using a quarterly panel data from April 2020, so pretty much at the start of the pandemic, and December 2022 for 5 European countries, France, Germany, Italy, Spain, and Sweden. So we argue that as the pandemic has produced a rapid restructuring of personal relationship, of course, it is possible that this might have contributed to a change in the nature of loneliness and its determinant during this very difficult time. So we try to answer with the paper 3 main questions. How did loneliness change over time? What are the determinants of loneliness during the pandemic, and if these are different from the pre-pandemic evidence? And how the pandemic measures in terms of lockdown measures, but also government support, might have actually affected loneliness if they had any effect on it. So to summarize the finding, we find that loneliness actually peaked in the early, so at the start of the pandemic, as you would expect, and follow a U-shaped pattern for the rest of the year. So it tend to actually remain stable in 2021 and 2022, and this is consistent across different demographics. Why the patterns, so the trends of loneliness did not change in terms of the demographics, so evidence for across demographics, this only exception with respect to the pre-pandemic evidence is that youngest generation are actually those who felt most lonely during the pandemic. And lockdown policies, as you would expect as well, tend to increase loneliness, while instead the government support is actually contributing to reducing it. And instead, the effect of the pandemic per se, in terms of COVID-19 deaths related, has had only a limited effect. So with this paper, we contribute to the broader literature that actually analyzed the impact of COVID-19 on a series of mental health outcome and life satisfaction. There is a very nice literature, systematic literature review by Prati and Mancini on a series of mental health outcomes, and they find that in this analysis of this contribution that those containment policies actually had an heterogeneous effect, and the correlation between lockdown and loneliness instead is positive, but the contribution that found this positive correlation, they have not estimated with a certain, there is some uncertainty around the effect. Some of the contribution have emphasized the presence of this recovery process where actually loneliness peak at the start of the pandemic and then tends to fall afterwards. But the main problem with this contribution that the majority of them tend to focus on a very short period of time, and they mail in the first few months at the start of the pandemic, while instead we will able to provide a much broader overview because our data extend for nearly the 2 years of the pandemic. So I will describe you briefly the data that we use for the analysis. This is CAMIR, is a survey, ongoing survey, longitudinal survey that has been implemented by the University of Luxembourg, is a national representative sample, at age, gender, and region of residence of adults from the 5 European countries that I mentioned before. The survey started in 2020 in April, so pretty much at the start of the pandemic, and included more than 8,000 participants, and about 1,500 of them are the panel component. An additional refresher has been introduced in November in order to compensate the attrition from the original sample. And I will show you later that actually we check if the attrition has actually an impact on our estimate, and we apply inverse probability weighting procedure in order to compensate for this effect, but the attrition does not change our main conclusion. The survey is very broad, contains a lot of information about many aspects of the respondent lives, but particularly with a focus on mental health and living conditions during the pandemic. As I said, CAMIR is quite unique in the sense that provides an unharmonized cross-country sampling, and it allows us to investigate the changing in loneliness, especially because of the correspondence with the pandemic during the data collection period. In the CAMIR, loneliness is measured using the UCLA loneliness scale with the 8-item version. This scale is the shorter version of the original scale that first was developed by Hayes and Di Matteo in 1987. But the original scale has 20 items, but the 8 version has been consistently validated across studies and has shown to be much more reliable than all the shorter version of the scale. So the scale has a range from 8 to 32 points, and of course, higher scores tend to correspond to higher level of loneliness. Our estimation sample is composed by 50,000 1987 observation on 11,000 respondents. I can't access. I'll try to show you. I'll try to quickly go through the presentation. I'd like to show you that this is the distribution. Sorry. Yeah. So this is the distribution of the average loneliness scores in our sample, and as you can see, is approximately is kind of a right skew, and the average score is around 16.30. And instead, this is the, sorry, where's the table? Yeah. So this is the items that compose the eight items of the scale, just to give you an idea. Going back to the data. So as I said, another part of the paper, one of the result question of the paper is try to capture how the pandemic measures have actually affected loneliness. And to do so, we use 2 indicators. One is the stringency index, that is a measure of containment policy. There's 2, and a measure of economic support. These are both 0 to 100 indices, and they've been developed by the University of Oxford. We also control for the evolution of the pandemic itself by including the daily number of COVID-19 deaths. But there is a disclaimer here. This measure, of course, cannot be interpreted as an effectiveness of the policy intervention, but rather a measure of their intensity. So this is the overview of the evolution of loneliness during the pandemic. As you can see, loneliness here peaked at the start of the pandemic in April 2020 with an average score of 16.7. But then just 2 months later, it drastically drops about 1 point and then tend to increase again following this U-shape form that I was telling you before, and then tend to actually stabilize by the end of the pandemic. But as I said before, we control for attrition, and I have here a graph to show you that even controlling and correcting our estimate for the attrition does not actually change the result, except that here, as you can see, the average score are actually higher, but the pattern is exactly the same. So in terms of the methodology, so in the first part, what we're trying to do is to identify, as I said before, the individual predictor of loneliness. In order to, since we don't have data before the pandemic, we can now actually make a comparison. So in some way, we use the pre-pandemic evidence. So what the literature told us about what are the predictor of loneliness before the pandemic, and compare our results. Here we use two different estimations. They build on each other, where we first control for a set of predetermined characteristics where this is, yes, okay, PI is the set of predetermined characteristics that are measured in April 2020, such as gender, level of education. And then we include as well a vector of time varying characteristics such as income, employment. And then we also include a measure of two measures of social interaction. Has been a drop in face-to-face or remote interaction. So there the number of times, so it's a count measure. And then we control for country fixed effect, wave fixed effect. And then in this second specification, we remove those predetermined characteristics, and we actually include them by controlling of individual fixed effects. So we exploit the final dimension of the data. So in the second part of the analysis, we then try to control for the effect of the pandemic. So we include in the regression, the same regression as before. So here the main difference is that we include the stringency index, the economic support index, and the COVID number of COVID deaths, the average over the previous 4 weeks. All these measures are standardized. So this is the result for the individual determinants of loneliness. As you can see, women consistently report higher level of loneliness, and this evidence and this result is actually consistent with the pre-pandemic evidence. In terms of the effect of age, while in the literature we know that some contribution have found a U-shaped relationship between age and loneliness, here we don't find evidence of this U-shaped relationship. As you can see, loneliness tend to actually reduce with age. So as younger individuals, actually those who feel more lonely, while instead older individuals are more likely to feel less lonely. Education has a protective effect. This is confirmed evidence from what we already know. When we include in the second specification those time variant characteristics such as income and employment status, as you can see, income is consistently as well a protective factor against loneliness. Interesting is that employment is increased loneliness in this specification, but when we control for a decrease in social interaction, both face-to-face and remote, the effect actually disappears in terms of significant but reverse sign. This is because most likely employed people might be those more impacted by the change in the disruption in the everyday routine in some way. But however, when we control and when we consider the final dimension, employment again seems to be a protective factor. And another important result is living with a partner is actually consistently a protective factor against loneliness in all the three main specifications. And of course, the huge relevance of the social, the change in social interaction in explaining, in predicting higher level of loneliness. Yeah, thank you. So here we have the results for the pandemic measures. So as you can see, the stringency index, so the intensity of the lockdown are associated with higher perceived loneliness. And this is consistent even when we control for predetermined characteristic and time varying characteristics, while instead the economic support reduce, so compensate the negative effect of the lockdown, and this is consistent in all three specifications. In terms of the evolution of the pandemic itself, the only positive and significant result coefficient is in the first specification, but the effect tends to disappear when we control for other predetermined characteristics. So we can say here that in some way both the measure implement, so the stringency and the economic support are in some way quasi-exogenous with respect to the individual effect, and there is some kind of psychological, even if we control for these objective indicators such as income and employment, there is still a positive effect, and so in some way the lockdown might have had a psychological effect on people. They might go beyond the simple change in the social interaction. We test here if I show you before this graph, so the blue line, that is actually the evolution over time of the pandemic. We test if the pandemic measure might have had an effect, a direct effect on the trend, so on the changes over time for loneliness. So here I report the coefficient of tree regression. The coefficient here are all estimated with respect to April 2020. And as you can see, where in the first specification, there are no controls, so just the wave damping, as I said, is equivalent to the graph that I showed you before. But when we introduce this predetermined control, loneliness tend to in some way flatten a bit. And then with the introduction of the pandemic variable, so the last specification, the coefficient actually reduced by half. So we can say that definitely the pandemic measure might have had a direct effect on loneliness. So to summarize, we try to, many of the individual characteristics that have been previously found correlated with loneliness tend to be still relevant during the pandemic. But the only exception is with relative to the younger individual, that in this case are those who are more likely to feel lonely, while instead we don't find evidence of the same for the older people. And this, we explain this as, of course, the change in the quantity of social interaction might largely explain why younger people might feel lonelier compared to the older generation. They may instead value more the quality of the social relationship. As I said, loneliness tend to change substantially over the pandemic, and the pandemic policy help to explain this pattern. So with lockdown policy that increased loneliness, while instead the economic support provided by the government in terms of income and debt reliefs actually reducing it. So the economic support programs tend to largely offset the negative consequence of the lockdown. And so the novelty of these results tends to emphasize how public policy can actually have a material effect on loneliness. And we argue that future research should actually try to focus on identify the type of governmental support that most actually mitigate loneliness. That's the end of it. Thank you.
Well, thank you. Just a curiosity. I've seen that you have put online and face-to-face interaction all together, while this kind of interaction actually, I mean, this behavior, these two behaviors actually has been affected by pandemics due to the increase in online interaction due to isolation. So I was wondering whether disentangle the two, dividing the two could change your estimate somehow or reveal something?
But here we consider them as a separate variable. So we construct them in the same way. So they are both account in terms of the reduction of interaction, but they are two separate variables. So we try to capture both the effect. Am I answering your question? Okay.
Thanks, Alessio. I wonder if you have an idea behind the mechanism through which government support policies affects loneliness.
I mean, what the idea here is, so what we try to do when we try to emphasize the relevance of the economic supported, we think there is some kind of psychological effect, because even when we control for income and education, as I said, income and employment, the relevance of economic support is still persist. And so in some way, there is some kind of maybe anticipation effect where individuals feel less lonely because they know that the government might actually do something to take care of them. But this is just a speculation that we propose in the paper.
Thank you very much for your presentation. So if I understood well, young people were more affected than before. What about the long-term impact on young people? Is it measured also? I mean, as far as usually young people are not alone, usually. Yeah. Is it possible to go on with the survey and try to find out about the impact, psychological impact on them?
Yeah, of course. So the survey is still ongoing, and we have a panel dimension in the survey that we use in the paper. But the problem is that as I said before, we have a problem with attrition, and the majority of those are actually the youngest or male individuals that tend to drop. But of course, the idea that we can exploit that panel dimension to follow young individuals and specifically focus on them. But yeah.
Thanks for your highly relevant work. Could you go one slide back, please? So, of course, what we see when you add the controls, that the line goes up, but the time trend is still there. The line with the controls goes still up. So am I correct that the upward sloping loneliness has nothing to do with COVID? Because the COVID controls, am I misinterpreting your graph or?
So what are you saying is that when we're moving up, there is still an effect of...
the line is still upward sloping.
Yeah, but the coefficient tends to reduce. So we move here from -2, so about maybe -1.5 point or something, to nearly 0 point something. So that's what we're trying to say to when we say that. But we say as well that when we add the pandemic variable, so they actually have an effect because they change the size of the coefficient. So I hope I explained it.
So just a question. In fact, I've done a survey during the pandemic also with Erasmus students, so intra. And in fact, we observed that it depends on the culture of students to be faced to the pandemic. So I've done also a survey in the University of Strasbourg for Erasmus students. And we observed that the way to face to the pandemic and the lockdown depends also on the culture of the student. And I think it could be interesting if you can, in fact, also observe that.
So you say that the Erasmus students have experienced differently loneliness according to the country where they come from?
Yeah.
Okay.
Okay. And in fact, they are not in the way to face in different way, in fact, you see?
Okay.
According to the culture or the values that they have and so on.
I mean,
it is in all discipline, in fact, not in economics management, but all discipline, in fact.
Okay. I mean, we know where they live, but we don't know. I mean, we know that they're students, the level of education that they have, but we don't know if, I mean, that we can just say where they live, don't where. So there'll be some extra information that we could perhaps ask.
In fact.
Yeah.
That's why maybe it is
okay.
Not the way to understand.
Maybe that's something we can control for. Thank you.